Director of Policy and Advocacy in Nigeria Health Watch, Ifeayi Nsofor, joins us now to discuss all these measures, from the reduction in the price of petrol to the travel ban and the suspension of religious gatherings. Thank you for joining us on TVC News at 7. In the wake of the coronavirus outbreak, now Nigeria is taking certain drastic measures, reducing the price of premium motor spirit, ordering a travel ban from countries with high risk of coronavirus, and even planning to suspend worship in parts of the country. Lagos has already made that move. What do you see as the implication of this move at this time?
Okay, so thank you for having me. So the moves are justified. They are based on evidence. They are based on the fact that if you look at the 8 cases that have been confirmed in Nigeria, all of them are imported, so they came from outside into the country. So the federal government, officially restricting travel from countries that have more than 1,000 cases of the coronavirus is justified at this point in time. But I also need to point out that in as much as the federal government has done that, we also have responsibilities as citizens, as well as leaders in different sectors. And I'm happy that in Lagos, the religious leaders are working with the government to restrict church gatherings and other religious gatherings, with more than 50 people in one place. But beyond that, we also need to also know, the things that we're supposed to do as individuals to make sure that we don't just prevent ourselves from getting the virus, but also, we prevent community transmission of the virus.
So what are some of those things we should take note of? Because talk about hand sanitizers, for instance, people are advised to wash their hands regularly, use hand sanitizers. But if you go to malls and markets today, hardly will you find a jar of hand sanitizer. So what do you advise people to do at this time?
Yeah, so to be honest, I'm not exactly a fan of hand sanitizers. I think people should wash their hands with water and soap. So even those malls, if they think that hand sanitizers are very expensive, they should have hand washing points, before you get into, those kind of malls where people are. Yeah. And beyond that, things like how do you cough? When you cough, do you cough into your hands or do you cough right in people's faces? You're supposed to cough right into the, the angle of your elbow, or if you have tissue paper, you cough directly into the tissue paper, then you dispose of it. And I think another thing that we should do is to make sure that if people are coughing or sneezing, we maintain a distance of at least 5 feet from the person that is coughing. But interestingly, in the office today, I was having a discussion with my colleagues, Vivian, and she pointed out that if we keep hearing about social distancing, internationally, but locally here in Lagos, for example, if somebody enters one of those yellow buses, what kind of social distance can you achieve in such a bus that is already packed with a lot of people? And this is where we have to be responsible as individuals.
Right, talking about that,
if you're in that kind of bus,
talking about that and efforts by the government to provide facilities where people can be in isolation or quarantine, as the case may be. We heard about that case in Enugu State where the 70-year-old woman actually passed on Sunday, whereas her test result came out negative on Monday. That brings to question our strength to actually quarantine people who test negative for the coronavirus. Where do you see us at this time?
Okay, so I mean, it's such a sad thing that the woman eventually passed away. May her soul rest in peace. But she was a 70-something-year-old woman. She may have been living with, other underlying illnesses that people at that age have. But having said that, I think in as much as the people think that it's only the federal government that has a say in this intervention, we should also be asking questions of our state governments and our local government. So, for example, in Enugu State, what kind of facilities, do they have, for that kind of quarantining? Because it's not the federal government that will come and do it for you within Enugu State. And for us in Nigeria Health Watch, last week we actually did a, we call it NAW Engage. We try to engage people on social media to say, have you asked your state governor your level of preparedness for your state? And even we have a project that we run called Prevent Epidemics Niger. What we try to do is to say that states and local government councils have responsibilities that they have to play as far as healthcare is concerned, but most importantly, as far as infectious disease prevention and response are concerned. So I need us to begin to shine light on different state government and different local government councils, because these are the levels of government that are closest to the people, and we must begin to hold them accountable to make sure that they do the right thing and they budget appropriately. So for 2021, for example, we should be asking, how many states have a budget line for epidemic preparedness? We just can't keep on depending on local government all the time, because if you look at the way health is structured in Nigeria, federal government has its own responsibilities, states have, local government councils have. So we must hold those three levels of government accountable and responsible for healthcare in Nigeria.
All right. In recent times, Nigeria has actually received accolades for its effort in tackling the coronavirus. But then these days will just come, to show the reality, and we hope that we're able to meet up with the standard. Ifeayi Nsofor, Director of Policy and Advocacy, Nigeria Health Watch, thank you for joining us on TVC News at 7.